On this episode of Bondi Vet,
there's a lot of delicate, life-threatening structures there.
Audrey and Alison perform a risky surgery to remove a dangerous lump from a kangaroo mum.
The jugular is literally right there.
One wrong move here and this could be really bad.
Oh no, her life could be in serious jeopardy.
A devastating diagnosis for much-loved Molly.
My biggest fear at the moment is she doesn't come home. Sorry.
Here we go.
I thought you had a baby.
There you go.
And will pram cat Sadie make her 18th birthday.
When we see a relationship as close as John and Sadie, I don't want to be the bringer of bad news.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
Twin mobile vets Alison and Audrey are on an urgent call-out to Possumwood Wildlife Sanctuary.
I'll show you. Yeah, this is the problem. I need to look at.
Baby.
Our first patient of the day is actually a wild kangaroo that was brought in, and we're very worried about her because she's got this huge mass just under her chin here. So that mass is looking really big and we're worried it's infection. We've started on some antibiotics and that's reduced the size. But what we find with these abscesses is that they tend to get quite severe. It can turn septic, which means that the infection goes into the blood. So keen to get in there, find out what's happening and try and get rid of that abscess and infection.
I mean, the only thing that worries me is we've got, jugular there. There's a lot of very, delicate, life-threatening structures there.
Definitely difficult surgery. They always take hours.
I'm a bit worried.
that.
What should we call you? Hey? Should we call you after my daughter? She's a bit wild. She jumps the couches.
Let's call you Fifi.
Should we call you Fifi?
You look like a Fifi to me.
Fifi climbs the couches.
And she also had a Joey that was very, very weak and malnourished.
Oh my goodness, look at this face.
So he was actually unable to move, and we think actually didn't have enough milk for the Joey. So we had to actually get them both into care and treat both of them. Oh gosh. So with that jugular vein just running straight under the mass, it's a really, really risky surgery.
You can see the jugular is just coming up right there. And going just under the lump. If we hit the jugular, it's going to be very stressful because we're going to have to stop the bleeding, and the jugular is one of the main veins in the body. So that's going to be quite a big bleed out and also quite concerning if we have to ligate that important vein. So we don't really want to have that as an option at all costs. We avoid the jugular. So I'm going to maybe start cutting from this side and then we'll peel back.
Cutting over it.
So I'm just blunt dissecting the abscess off the skin, and we're just going really carefully because we know that the jugular is lying at that point.
Holding Fifi's head really, really still because I want Audrey to be able to really dissect carefully. The jugular is literally right there, just under her finger.
So one wrong move here and this could be really bad. Back a touch, Crystal. Just back about 5 centimeters. Oh, and then up.
Poor Fifi, I can't imagine how uncomfortable this must be. So every time she opens and closes her jaw, it must be super painful.
Yeah, it's like right in that angle of the jaw. Okay, so we've managed to dissect it off the jugular, we've managed to dissect it off the lymph node, and it's the moment of truth. We're going to remove it from the neck.
Last little bit.
Okay, it's coming.
Yes, we got it all. That was the bit that was under the jugular.
Good job. Yay! Hard jump. It was a lot of work because it was attached to so many important structures, but it all came away really well.
Just very curious to see what sort of abscess this is. So I'm actually going to slice it open and have a look on the inside. Audrey.
What?
It's not an abscess.
What is it? We better send that off for histopathology. That doesn't look like a typical abscess.
No, it looks like a tumor.
Fifi's not in the all clear yet. If this mass comes back to be a tumor, then it could be more health problems for Fifi.
So we'll send that off to the lab and see what it comes back with.
Now that the surgery is over, we're on to the next big hurdle, which is the recovery phase. The recovery is usually the touch and go part. A lot of them we can lose during the recovery. So every single kangaroo we've lost has been in recovery. They can either stop breathing or their heart will just slow down.
Looks like she's waking up, she's moving her tail.
You're going up. She's starting to twitch and lift her head and swallow, so I'm really, really relieved. I think she's going to make it through.
She puts it. So we're gonna let her have a nice sleep and we'll check on her in the morning.
Have a good sleep. You're a bit scruffy too. Hi, Fifi. How are you? Oh, look, you're standing. Have you had your drinkies? How's that one looking? It's looking really good, nice and dry. For a wild girl, she's very, very good, very receptive to help. So now that Fifi is bright, alert and responsive and she's recovered really well, what we're going to do is grab her Joey and give her a big surprise.
Oh, he's so skinny. I think every life is a life worth saving. And that's what we do as vets, is we help animals, we treat animals, we make them better, we give them a better quality of life. And I think that's the compassion of vets, and especially wildlife work. She's cleaning him.
If an animal comes in and it's ill or it's sick, we're going to help it. It's just what we do and it's what we love. It couldn't have gone any better, really. She's embraced it, he's jumped in, she's cleaning and toileting him now, so couldn't be better.
Scott, look at you and see what's gonna go on. See what's gonna go on with the baby. Here we go. Here we go.
Hey, John, how you going?
Scott's first appointment is American John and his much-loved 17-year-old Sadie.
Let's go on through and get her out of this wet weather. Hello, old
There we are. Hey, baby.
Hello, sweetheart. John absolutely loves his cat and he gives no excuses. And I think it's fantastic. Good girl. There we go. I know, you're so good. Well done.
I do find it reassuring in Britain that I'm not looked on as the eccentric cat guy. It's the British madness about their animals dovetails in wonderfully with how I feel.
Okay, gorgeous. Let's have a little look at you now. Yeah, good girl. 18, you said, didn't you?
18 next month.
What sort of events do we think we're gonna organise for her?
Well, certainly her first pint. Take the pram into the pub. I'm sure they'll love that. And,
yeah, what kind of reaction do you get when you bring the cat pram into a public space?
well, they normally think it's the baby pram until they hear the meowing, and then we get quite the look. Oh, hey, who's your friends?
I thought you had a baby.
No, it's a cat. I say,
Oh, he doesn't, he's not best friendly to...
Oh, that's okay. All right, see you guys. Bye now. There's some nice puppies.
John and his wife Tracy moved from the United States to the UK 2 years ago.
The pram thing came about when we first moved over. We didn't have a car, and in America you have to have a car for everything. So we didn't think about how we were going to get Sadie from home to the vet. There you go. Hey, sweetie.
He struts up here, Richmond Hill, with his cat in a pram. He's loud and proud. He's out there, I love my cat and she loves me. Good on him.
Don't take her out too often because she usually thinks she's coming here. Come on now.
No offense.
But today, John is worried about his aging sweetheart.
John, I tell you what, she is looking thin, isn't she?
Yeah, she's feeling more and more bony.
Yeah, I can feel your ribs.
It was only 2 years ago that Sadie's sibling Peanut died from kidney disease.
Her brother cat, Peanut, had the same noticeable signs of the weight loss. We noticed with his haunches getting skinnier and the back getting ricketier. And so we saw that happening with Sadie, and we decided to bring her in, see what you have to say about it.
Sean, what I can tell you about the weight that we've found today is that she is 2.5 kilograms. She has been up to 4 kilograms back 3 years ago. That's a huge amount of weight for us to lose. So you or I losing nearly half of our body weight. So for a cat, it certainly shows that there is definitely some problems afoot. We do need to look into this pretty seriously. It's been steadily dropping, but it's really dropped this time round, so I really do want to get to grips as to why. And obviously she is not the biggest fan of the vet practice, so we take that into account when we hear a slightly higher heart rate, but her heart rate is pretty fast.
Yeah.
I think in this instance, she's showing fairly classic signs of an old lady, an old cat. There's a number of different things that this could possibly be. First thing we'll be doing today is taking a blood sample, and we'll be looking at not only kidney function, but also her thyroid level as well. And the other thing is just checking our blood pressure, because when a cat has got high thyroid level or high thyroid hormone, it does drive up their blood pressure. And that we need to determine now, because in future, if we start to treat it and the blood pressure drops, we might see its effect on kidneys. When we see a relationship as close as John and Sadie, I don't want to be the bringer of bad news.
You sweet thing, that's a good girl. I work at home as a computer programmer. I am with her 24 hours a day, and from the time I wake up, she's spent the night in bed. I have to carry her on my shoulders to get ready in the morning, put that pot of coffee on, come downstairs, and then she's in my lap all day. She demands love pretty much 24/7. So it's certainly a very hands-on relationship, but it's one I think that she really enjoys. She really enjoys just having me there all the time.
So let me get this right.
Oh, yeah.
You work from home.
Yes.
With your cat all day.
Yes.
The cat has a cat pram that you bring to the vet clinic, and now I find out that she actually is your bedfellow.
Bedfellow, yes.
Does your wife at all feel jealous in this situation?
I think she understands that Sadie kind of came before the marriage, so.
Right, and of course the cat can't use your credit card, so I suppose she gets her own back.
Not that I know of.
The British love their animals to the point of obsession, and I definitely think that John is the poster boy for the American contingent of mad cat people. All right then, John, well, I'm going to take you now, and we'll start doing the blood pressure and the bloods, but I will be looking after your beloved. Come on then, I know. You love your daddy, don't you?
You guys for a second.
Of course, she's 18. She isn't going to last forever, and today is all about finding out how long she might last for. All right, I'll get as much information as quick as I can for you, okay?
Okay. See you in a bit.
Hey guys, I've got John's mistress here. We need to treat her very, very delicately.
Hi,
She's lost quite a bit of weight of late, so we're just going to look into that a bit. You know what's funny when I'm consulting with John and Sadie is that you almost feel like you shouldn't be in the room, like you're like the third wheel. You know?
There's so much love between the two of them.
Yeah, so I need to make sure that she is passed back to him in an equal state.
Indeed.
Of love and devotion.
It's tough seeing what she's going through now. I can't imagine her being gone. She's been in my life longer than my wife, and if a cat of 18 or hopefully 19 or 20 years, when she's gone, it'll be devastating.
So the first thing we're going to do is just try this blood pressure out. The conditions in Sadie's case most likely are going to be kidney disease in the form of renal failure, where the kidneys fail to function as well as they used to. Not too high at 130, that's perfect. Hypothyroidism is the next possibility, and that is basically where a cat produces an excessive amount of thyroid hormone, usually because they've got a benign growth that's growing on their thyroid gland in their neck. And that basically drives their metabolic rate very, very fast, so they eat for England and yet lose weight. Sodium potassium ratio is normal.
Good.
Pretty good.
For a 17-year-old?
Good results to pass back to John. Sadie, so I don't think you're going to be impressed with the lifestyle changes that I'm going to implement, but I think it will help you get to that 18th birthday. It's a massive relief today for me to find out that Sadie's health is intact. There we go, here's Daddy.
Hey, baby.
There you go.
Hey, sweetie.
All right, so she was so good, incredibly good. And the news is good.
Okay,
So,
great.
of course, we have to take into account she has lost the amount of weight she's lost. So we do need to keep a very close eye on your lady, but her kidneys are functioning not too badly.
Okay.
And she doesn't have hypothyroidism. So
wonderful.
So far, so very good. And one thing we are going to have to do is to just change her lifestyle a little. So what we're going to do is enact a new type of food. So it'll just bring down the amount of protein she consumes, just brings down the amount of work the kidneys have to do as well. So with that simple lifestyle change of changing the food that she's eating, I think that Sadie will absolutely breeze through to that 18th birthday. And I don't think, though, that she can really drink a pint, but John and I are more than happy to enjoy it for her.
Okay, thanks. See you soon.
See you soon.
Okay,
all the best.
Thanks.
Bye-bye.
Here we go, baby.
Good girl. Happy birthday, Sadie.
And Sadie has made it to her big birthday milestone.
Is that tasty?
John's invited Scott to the celebration.
Oh, I felt incredibly privileged to be invited to Sadie's 18th birthday. It's not very often that you get to have a beer with a client, but a beer with a client in a pub with a cat in a pram turning 18, that's special. All right, and I see you've got a nice little birthday card. Do you mind if I open it on her behalf?
Oh, please do.
Okay, let's have a look at Sadie.
There you go, Sadie.
There you go.
Look.
Do you want to read it? It's your birthday today. Happy birthday, Sadie. Thanks for 18 amazing years, hoping for a few more healthy ones together. Love, Mummy and Daddy. Ah, isn't that nice? Hey, isn't that lovely?
Not so happy, huh?
Yeah. I'm not convinced that Sadie was particularly happy with me being at the pub with John, her beloved. Quite frankly, I think she would have ditched the beer and the pub for a lovely snuggle back at home, listening to just the two of us. Cheers.
There you go. Cheers.
Happy 18th birthday.
Thank you.
Hey?
Happy 18th birthday, Sadie.
Good girl.
It's been a good run.
Very good.
Good girl, honey. Okay, so this dog's come in and she's not looking good at all. Hey, that feels really bloated.
At the Bondi Referral Hospital SASH, 6-year-old Molly has been rushed in with a badly swollen stomach.
When I feel her abdomen, it does feel bloated. She's really not in a stable condition, so we've got to act fast.
Emergency vet Dr. Lisa Chimes is worried the listless greyhound has a dangerous condition called bloat.
Their stomach basically fills up with air and becomes massive. And the risk is that that stomach can twist, cutting off the blood supply to vital organs, and that can kill them. All right, honey, let's get an x-ray done.
Owner Bethany is a former vet nurse and recognised the symptoms straight away.
I've had a dog pass away with bloat about 10 years ago, and seeing Molly's symptoms, it kind of has given me a big scare, and I'm just hoping that what they find is not what I'm thinking, but I'm worried.
All right, come on, Molly. That's a girl. I need to take an x-ray of Molly's abdomen right away, because if she's got a bloated, twisted stomach, her life could be in serious jeopardy. Good girl. Stay there, Molly.
Molly's devoted owner is anxiously waiting for the results.
Oh no, this is bad. When I look at Molly's x-ray, her stomach is absolutely massive, and it's very obvious that it's twisted. Now, that is something that needs surgery, and without it, Molly won't survive. So, I've taken an x-ray of Molly, and it shows that she has got a bloated and twisted stomach. So, she needs emergency surgery.
Okay. Can I see her?
Absolutely. Come through.
My greatest fear is losing her, and that's not an option for me. I just want to make sure that she's okay, and I just can't lose her.
Molly's life-saving surgery needs to happen immediately.
You'll be good. You're good, okay?
It's absolutely heartbreaking just to think that she's about to go through major surgery, and I just can't be there with her. My biggest fear at the moment is she doesn't come home.
Sorry.
All right, sleepy, sleepy girl.
Good girl.
Let's get her up. Okay, pups. Having a twisted stomach is one of the most life-threatening conditions a dog can have, and if we don't operate on Molly, there is no way she'll survive. Oh no.
But suddenly, Molly's system begins to crash.
Her ECG is showing that her heart is racing. She's got a really dangerous arrhythmia, and if we don't treat it, that could kill her instantly.
Molly's abnormal heartbeat is a sign that her stomach is causing extreme pain.
We need to stabilise Molly and get her heart under control before we do anything else.
Lisa and the team are using a pain relief drug to try to lower Molly's heart rate.
Heart rate's 112. Slowed a lot. Let's just get her in there, right?
Surgery can now get underway, but everyone is still on edge.
Molly's an unstable dog. Now she's under anaesthetic, anything could go wrong.
Specialist surgeon Dr. Ricky Cashmore will perform the delicate operation.
The goal of this surgery is to get the stomach untwisted and deflated as quick as possible. So additional to the stomach actually twisting, the spleen is twisted too, and all the blood supply to the spleen is actually thrombosed and clotted. So to prevent it from actually rotting in the abdomen, we're going to have to actually remove the spleen. Okay. We've been able to remove the spleen successfully, and now we need to untwist the stomach. Fortunately, her stomach has returned to normal colour, so she doesn't appear to have any permanent damage, which is very lucky.
With the stomach untwisted, Ricky is now going to stitch it to the abdominal wall. This will prevent it from twisting in the future.
That's it. Awesome. Although the surgery's gone well, there's still a small chance she could have serious problems, so she's going to have to recover in the ICU, where she'll be monitored closely for the next couple of days.
Hey, Molly. How are you doing, honey? Come on out. Molly came in here yesterday with a twisted stomach and she needed emergency surgery to have that stomach put back in position and have her spleen removed. I'm going to take a look at her and see how she's doing. A good girl, hey? Look really good. Most animals that have the same problem as Molly take a few days to recover, and Molly overnight is looking so much better. She hasn't had any complications, that arrhythmia has resolved, and I think she's ready to go home. Should we go see Mum? Okay, let's go.
I'm really excited to be able to take Molly home tonight. Normally they need to stay in hospital for a lot longer than this, but she's a fighter, my dog.
Hey, baby. Hello, my meal. Hi. Hello. How are you?
I'm so relieved that Molly has pulled through. Knowing how severe this sort of situation can be, and the fact that she's pulled through is amazing. She's happy, she's bright, she looks incredible.
All right, so this is it.
Yay.
Bye, sweetheart. Hey, you be a good girl for Mum. Hey? Oh, you're a lucky thing. When Bethany first brought Molly in here, she was absolutely devastated. She didn't even know if Molly was going to survive. And now she's taking her home and she must be over the moon. Bye.
Hey, Lisa, thank you.
Pleasure.
Come on.
These little critters have been singled out by some as the biggest threat to Australian wildlife since European settlement. Even more than other introduced animals like pigs, cats and camels, the highly poisonous cane toad has indeed had a profound effect on Australia's wildlife. But I'll probably surprise a few people here. I love them. Cane toads are from South America. They were introduced back in 1935. They were brought in to eat the sugarcane beetle in Queensland. But with no natural predator here, they spread like the plague. They can now be found from Queensland, through the Northern Territory and into Western Australia. And there's no doubt about it, they do kill animals I love. It's absolutely clear that snakes, lizards and croc numbers have suffered. Finding any one of these with a toad in its mouth is not uncommon if you take a walk out into the bush. The problem is, they can't handle the poison secreted by toady here. When it's threatened, these glands here that stretch from behind the eyes, down past the shoulders, secrete a white fluid called a buffotoxin. This stuff's not only deadly to animals, but it can kill humans too. Ingest the poison and you'll soon be salivating, then twitching, vomiting, and you could be dead within 15 minutes from a heart attack. The problem we have here in Australia is there aren't enough predators that keep the cane toad numbers in check, like back home in South America. One that is the wily old crow. Most birds aren't known to be affected by the poison, but there's nothing like a crow to delve where others wouldn't dare. The trouble is, we can't rely on crows to stem the tide of cane toad domination. When you consider females lay between 8 and 25,000 eggs at a time, and fully grown, an adult will consume far more than any native frog, you can gauge just how big a problem there is. But it might not be all bad. Since the first 101 got off the boat 80 years ago, they've in fact helped numbers of certain species. Certainly some common reptiles and amphibian numbers are much healthier. This is due to the fact that predator numbers are kept down by eating cane toads. And there's evidence to suggest that some predatory species have learnt to avoid toads as food. Even though there's experts out there coming up with ways to reduce numbers, the cane toad, in my opinion, is here to stay. So you might ask, if these fellas are killing so many animals that I love, why do I still love them? Well, plenty may think they're just darn ugly, but look at that. What a handsome fella.